Hi, I'm Marc Tobias, CEO of Phrase Health. I'm going to do a brief introduction to the platform today. First off, when you log into Phrase Health via your single sign-on credentials at your local organization, you'll be presented with the screen here, which shows you all the different types of content that we ingest on a daily basis from your electronic health record system. The knowledge sync module here, which we won't go into today, but allows you to start doing some metadata management and governance around the content. Different pieces of content within Phrase Health that you've recently looked at so that you can jump right back in. And lastly, some of the favorites that you can highlight and bookmark and have easy access from the homepage. For the purposes of today, I'm going to jump into order sets. And this is where you're able to see high-level view of what's getting used most, some different metrics we'll get into in a second. You have the ability to create order set groups. And this allows you to bundle multiple pieces of content together for broader analysis. And then a catalog view of your content so that you can dive more into it. For the purposes of this demo, I'm going to be looking at the follow-on orders index. What this index represents is when a clinician uses an order set, within 5 minutes starts placing orders outside of the order set on that same patient. A really nice way of picking up variation in care and where there may be opportunities to improve your order set design. But first of all, this is a benchmarkable metric, so we can see how your organization compares with others. And I'm going to look at this ED sepsis pathway order set, which has the highest follow-on orders index score. When you go into an individual order set, you're presented with the screen, which looks similar across all the different pieces of content. Along the top, we're looking at the analytics, but we can also see the previews and other tabs here, which I'll get into in a moment, and that's how you navigate different components of this piece of content. Just like any good business intelligence tool, we can navigate to a different dimension. And here we're looking at orders within 5 minutes. We can see about 40% of the time when this order set is used, this order is being placed of gas with lactate. With the click of a button, I can filter it down. And now I can go in and see, well, which providers are ordering within 5 minutes if I want to do a reach out, which encounters this is occurring in if I want to do more exploration. And ultimately, what are the orders that were placed when that extra order was placed? Understand how that user or how those users are placing these additional orders. So what's really important is the ability to also start aligning usage with design. And this is extremely important when we want to understand the why behind why users are ordering things a certain way. So our system will regenerate what the content looks like, show what's defaulted at the system level, as well as how different orders are being placed. And not surprisingly, the ones that are defaulted are the ones that are more typically placed here. We do see that that gas with lactate is within the order set, but it's not pre-checked. And right away, we've kind of gone through the process of understanding how the order set is being used, others variants coming from it, and potentially where a design element may be influencing that piece of content. Now, finally, this is where we get into some of the metadata pieces around the content. So we could add a tag and say, I'm going to add this as sepsis. And now when we want to go find this content in the future, we can save it and favorite it. We can also look for it through our tags interface and potentially start adding owners so that they will get messages around comments and feedback that's coming through the system. So that's the first introduction to Phrase Health. Please reach out if you have any questions or would like further demo as a platform.